G'day you mob, welcome to this episode of Aussie English. I'm your host Pete, and today we are in the Goss, right? We're going to be talking about the Goss Down Under. This is a Goss episode. So today I'm sitting down with my old man Ian Smissen, although because we're in lockdown stage 3, we are doing this via Zoom. But I'm sitting down with my old man and we're going to be talking about how COVID is going, specifically in Victoria. Like, it's in Australia, sort of popping up all over the place at the moment. But in Victoria, you probably know that numbers have sort of gone out of control recently. We talk about the aged healthcare sort of crisis down here with COVID. We talk about the healthcare system in Australia versus America and why America's kind of scares the crap out of both me and my dad in terms of how expensive it is, and insurance. We talk about childcare, why it's so expensive, and one-income households. Then we chat about Indigenous football players, as well as Indigenous languages and linguistics, and how it differs a great deal from, say, English, or at least, Indigenous languages in Australia do. And then we talk about, lastly, 750 million mosquitoes about to be released into the Florida Keys and why they would be doing that. Anyway, without any further ado, guys, smack the bird. Let's get into it. So how are you going? What's the Goss, Dad?
Good, yeah. Well, not much. Just sorry, looking away from the camera. The bloody weather here at the moment's atrocious. So we're getting a late winter. It should be crawling into spring now, and the flowers are certainly coming out. But the weather today, it's about 8 degrees and it's hailing. The hail's just stopped, fortunately. Otherwise, you wouldn't be able to hear anything. But
yeah, true. I wasn't
sorry,
thinking
I'm not
about
drinking beer. I'm on kombucha.
Why would it matter if you were drinking beer?
It's a bit early.
They don't know that. Tell them it's midnight.
Yeah, well, there is that, yes.
But how are you surviving? What's the latest status on Victoria? Although this will be a few weeks, maybe a month delayed, but we're currently at about...
Yeah, who knows what it'll be by the time we get this hits the air. But at the moment, I think it was down to 180-something new cases, and a lot of the old cases are now dropping off because people have survived and cured and got through it. So we're on the downward slope, thankfully, but we're still getting 170 something yesterday, 180 something today, and I think we still had 13 deaths. So the deaths are still up, which is obviously unfortunate would be a trivial way of putting it, but we don't have any way of handling that because the deaths are obviously a hangover from when there were spikes previously, but fortunately it's not getting any worse. Yeah.
Well, and what's the status with, I don't know if it's a Royal Commission, but they've been looking into what's going on in aged healthcare, right?
Yeah, there is a review of that, and that's obviously broader than just what's happening with COVID. It was a matter of whether the aged care system was set up to cope, and it appears it's not. Obviously, the findings haven't come out from that officially yet, but little bits trickle out on a daily basis and hit the news. So it just seems to me that certainly the private sector, because most of our aged care is private, once you turn something into a profit-making system, then all the background checks and all the setting the system up to cope with, in this case, a once-in-a-100-year problem, people are just not going to do it. And unless they're regulated to do it, they're not going to. And frankly, why would they? Because they're in it to make money, which is highly unfortunate. But
yeah. Well, you'd like to think that the market would set it up to be working well, though, right? That the more you pay, the better the service you get. They want to shape themselves up to make as much money as possible, which means that they end up making, a better service. But it seems like, at least in the case of what we've recently discovered in Australia, there's been a lot of corners cut. Staff are being, wheeled around from one place to another, which has sort of allowed COVID to spread. They've been understaffed. I think one of the old care homes had something like one staffer to every 19 elderly people that were there, or something crazy.
On that basis, you're giving somebody, less than an hour attention a day, and that's, just atrocious, obviously. But it's a problem with privatising those sort of things. You privatise care of people, and as you turn it into a profit and loss business, then people are going to look for ways of cutting costs because you can't bump the price up. It's already extraordinarily expensive and very few people can afford it without having some form of support.
Yeah.
And, that means that, the only way you can continue to make money in that business is to cut costs. And unfortunately, cutting costs is cutting services. I mean, some, I'm sure, are very good, but others appear not to be.
Well, it's very interesting, right? Because you recently had your heart surgery stuff at a private hospital, right?
Yeah.
And so you had insurance, but it was paying a privatized hospital to do it, and they you would imagine done a better job than a public hospital. Well, probably maybe a similar job, but you could get
not a better
track.
job. But I got in when my cardiologist could book me in to suit me and him. It wasn't, we'll get you in at the next available slot, which will be in 12 months' time. If it's not emergency surgery at a public hospital, you go onto a waiting list, and the waiting lists just keep getting pushed out because clearly they're dealing with emergencies as their primary business, and so elective surgery just keeps getting pushed out. So it's put it into a private system where if you pay private health insurance, then it means that I ended up paying less than $500 for what would have cost me $15,000 to pay for it myself.
And imagine
it would have cost me nothing if I'd gone to a public hospital,
but
I'd still be waiting for another year probably to get in.
But doesn't that blow your mind too? Because I was watching a video the other day. Don't ask me how I found this, and hopefully,
how did you find it?
Hopefully, my sister doesn't mind me talking about it. But the video was about a woman who had 2 prosthetic eyes, and she was showing how they were created and how she inserted them and everything like that. And obviously, I don't know if it's a big issue to mention, but my sister has a prosthetic eye. She had to have that made when she was younger, right, and changed multiple times as she grew.
Yeah, well, eyes don't grow much after you're sort of a middle-aged child. Your eyes don't grow that much, but obviously your face changes shape, and so they have to fit that in. So,
But the crazy thing was, this woman was saying she had to spend something like $20,000 an eye. It was tens of thousands of dollars to have one eye made, which just looks like, what would you say? It's almost like porcelain, really hard material that's then painted.
Yes.
And obviously the process in the US is the same as it would be here, you'd imagine, but because of the way that they have their health system set up, it is extremely expensive. And I was going to say, for my sister, what was the price to have that sort of thing done? Or was it covered by just the healthcare system? And we didn't
I know what we paid. I don't know what the total cost was, and whether there's some joint payment with Medicare and stuff. I actually don't know. It was a long time ago since we paid for it, but it was a couple of $1,000s. So
yeah, that's insane. It just makes me because it tends to be a 10-to-1 almost ratio, right, between the US and here at times. The same with your heart surgery. It probably would have cost you tens of thousands of dollars to have done that in the US, as if you didn't have your own insurance, or if you didn't have insurance that covered it, right? So,
it's a bit bizarre. It's one of I honestly don't understand the health payment system in the United States. It's way too complicated for me to understand when I have what I think are perfectly intelligent, sensible friends and relatives who swear at me black and blue that the last thing they want is universal health coverage because it'll reduce their ability to get health service. And I said, but you can afford private health insurance. What about the people who can't?
Yeah.
And there doesn't seem to be an answer for that. It's mind-boggling. But look, I do know that I'm sure that part of the problem in the United States for the cost of health is the fact that health insurance companies are available to people who've got money, and therefore the price can go up. Medical providers can bump the price up because the health insurance will pay it, and the health insurance companies are huge and they control a lot of the health services.
And they have incentives to not pay out.
Fox in charge of the hen house problem.
What their incentive is to not pay out. It's not their first. Their incentives are literally, how do we statistically make as much money from people as possible? We need them to pay more than they're ever going to take out, and we're going to invest it meanwhile and make money off that, right? So I don't know. I was just thinking about it because I would love to live in America in terms of, the place geographically. It seems beautiful. There are aspects of the culture I don't like.
It's a spectacular place.
There are aspects of the culture I do love, but the thing that I think would just always stop me if I had the opportunity is the healthcare, because I would just feel terrified that either suddenly I'm going to have a problem that's going to cost me tens of thousands, maybe hundreds of thousands of dollars, like if I had to amputate a leg or something randomly and didn't have insurance, or that I have to pay insurance through the nose to cover myself and
elective
my family.
surgery. Yeah, elective surgery. Emergency surgery will be covered mostly, you would think, but elective surgery is just ridiculously expensive. And you're in that situation being self-employed where you would just have to cover that cost yourself, whereas most people's employment provides health insurance for them.
But they were saying when I was learning a bit more about that, it's an imbalance, right, of power.
Yes.
Because the employer all of a sudden has all of this control over effectively the future health of your family.
Yeah.
So you're bent over a barrel having to do whatever you can to maintain that job. And so the incentives are totally skewed, and the power is massively skewed.
Yeah, I don't think too many people who are in a well-paid job in Australia would have a problem with resigning from a financial point of view if they thought they could go and get another job. Whereas in America, there is that additional thing, well, I can resign and yes, I'm not going to get paid, but I can go and get another job. But if I lose my health insurance, what happens in the meantime? I've got to go and find another job that has the same health cover. So sort of a bit bizarre where you get those sort of bonuses thrown in as part of a salary package, but then you become totally dependent on it. It's not like,
it's like an addiction.
I used to have, a previous employer, I had a car as part of my salary package, but I could live without the car. Whereas I couldn't have afforded, if I was in America, I couldn't afford to live without health insurance. So, adding that as an incentive is it's no longer an incentive, it's sort of mandatory now. But then you've got the significant number of people who are working casually, self-employed, unemployed, who just simply don't have that option of their employer covering their health insurance, who just go without it. Whereas we in Australia just take it for granted that for an emergency, you're covered. If you have a problem, you need to go to a doctor or a hospital, you're covered. The government pays. Yes, your hospital, if you can find a doctor that will bulk bill you, in other words, all they will do is take the government's money, and there are still a few that do.
We did that to pause you there. Like,
ago now.
Kel just had to do a bit of fishing around locally, and she found a place that bulk billed. And she was just like, I'm happy to go there, blah, 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 for all the stuff with no, it doesn't bother me. And I was like, because I just go to the same one I've always gone to, because it's just the one I've always gone to, but they don't bulk bill, so you tend to have to pay.
Your child gets sick, you want to do a quick checkup.
Yeah.
Yeah, you don't really care which doctor you go to. They're just going to do a quick test. You just got a cold, or it could be COVID, go and get a test, or no, put him in hospital, all of which will be covered. But then if you can get that effectively for free, because the government is covering it, people will do that. It's when you have an ongoing relationship with your general practitioner that you want to choose the general practitioner that you pay. But I pay, when I don't get bulk billed, I pay about $75 for a consultation doctor, and I get half of that back. So go to the doctor, it costs me $37. And you can't really complain about that.
Well, it shits me to some extent sometimes, especially if I just need a prescription renewed and I go to the main one and it costs me $35, and I'm like, I literally just needed you to print something out.
Yeah, I know bill me for that because I've got an ongoing prescription, but so do you.
Yeah, but I do as well. But they'll still sit you down. They'll sit you down. They'll be like, "How are you going? How are you feeling?" And I'm like, "I don't want to talk. I just want the prescription renewed. I've been on this, medication for years now. It's not going to suddenly change. I know what's happening."
It's not like the medication that you're on. Unlike the medication I'm on, which can have significant side effects, and so it should be incumbent on your general practitioner not just to write you out another prescription every 6 months if there's a chance that, hey, we need to check your blood pressure, your pulse, we need a blood test every year, all of those sort of things, which is what I have to do.
Yeah.
But, you're right. But even now, if I need a prescription, I just ring up, and because we're in COVID at the moment, with the lockdown,
exactly.
It's telehealth. So the doctor just me and just says, "You're okay? Yep. How do you think your blood pressure is? I haven't fallen over today. All right, good. You're okay." Just here, I'll send the prescription to your pharmacist. I don't even need to go drop in and get it. I'll just send it to the pharmacy. So it's okay. But I don't think we've got much to complain about with our health service in Australia. It would be nice if we had better pay for, doctors are reasonably well paid, but for, paramedical people like nurses, ambulance people, general staff in hospitals don't get paid that well in comparison with the risk that they're taking at the moment. So
that's the difficult thing, I think, when it's not privatized, right? Because, I mean, there's the two sides. Privatization can lead to incredible manipulation and taking advantage of customers and everything, but at the same time, it can also allow people who are incredibly talented and hardworking to flourish and earn their just desserts, right? Or get their fair share of what they deserve. Like if you're, the best heart surgeon in Australia, you're probably not going to make anywhere near as much as the best heart surgeon in the US because of their privatization system, right? Over there, people, obviously you'll be serving the richest of the rich, but they'll be lining up to come to you. And so that you would think that's the only thing that worries me about those sorts of systems when it's a bit socialized and the government's dealing with it. It kind of makes everyone equal. And so I don't know how much of the drive it takes from people to actually go the extra mile, because there is no monetary compensation for, say, nurses at the front line.
Well, I think you've hit it there, is that for people like doctors, which have a one-to-one relationship with the partner, the patient, not partner. This is not alcoholic, I promise you. With one-to-one relationship with the patient, and when you're talking about a specialist like an anaesthetist or a surgeon or a cardiologist or whatever, I'm paying them directly. Yeah. Whereas I don't pay the nurses. The nurses are just staff at the hospital; they get covered. When I get if I get an ambulance, the paramedics, I don't pay the paramedics. I pay the ambulance service, and in my case, that's covered by our health insurance as well. But whereas doctors, you can get that sort of. If I become the best, heart surgeon, I am likely to get paid more because of whatever I've done to get there. Whereas nurses are nurses, and ambos are ambos, and so on. So, and they are paid at pay scales based on experience and position. And yes, you can work harder to get promoted and do all those sort of things, but the average salary is set. There's nothing you can do. I could be, whatever, a level X nurse in a hospital, and I'm going to get paid the same amount whether I work my butt off or whether I just turn up and do my job.
Exactly.
And I think there are a lot of those, what I call essential services in our community, nurses, ambos, fire, police, teachers, that are significantly underpaid for the value of the service that they provide to us. But there's no way that we can get around that while effectively the money they're earning is set by the government. Other than private schools can pay their teachers what they like, but private hospitals can pay their staff what they like. But again, they're not going to pay much more above the standard rates because why would they? You're not going to attract the best just by paying an extra few thousand a year in those sort of jobs. So I think that's one of the unfortunate things with our the public service systems, where you have people who are your average public servant that's sitting in an office and doing their job. They get paid reasonably well for the job they do, but the emergency services and teachers, childcare workers, those sort of people are significantly underpaid in comparison with some other professions that have no greater. A lawyer has probably less training than most teachers. In order, now they're typically double degrees, but they're getting paid huge amounts of money because it's a one-to-one relationship with your clients.
I don't even think it's that though, right? Like. It's more about the monetary relationship with the client. You don't have to be well trained to be worth a shitload more than a nurse or a childcare worker to the individual who's getting your services, right? So, I think you had that story about the guy who his car broke down and he drove into a petrol place where it was servo somewhere, and the guy's like, "Oh yeah, I see the problem. I can fix it, but it'll cost you $50." Yeah, and then he's like, "Here's $50," and he just went bang, fixed. And at that point, the guy wasn't paying for not even the training, right? The guy could be paying $50 to a complete stranger who could solve that problem. What he was paying for was the ability for his car to work and for him to leave. And if that was valued at $50 or $1,000, that's what the value of it is. I guess the problem with things like childcare is that you can't really justify saying, pay me $1,000 an hour to take care of your child because I'm more trained than anyone else that can do this job. Whereas if you're a barrister who's Australia's, in a QC, one of the best defense lawyers in Australia, you can clearly just say, I can probably get you off XYZ or sue these people and make you this much money or save you this much money, give me a fraction of it, and that fraction's going to be tens of thousands, hundreds of thousands of dollars.
Yes, yeah.
But what do you do with, I don't know why we're both so phlegmy. What do you do with...
it's the weather. Yeah.
With childcare, for instance, because I know the government and people keep saying we need to make childcare more affordable, but we need childcare workers to be paid more. And you kind of like, I don't know how that works.
I know it's
so we want
it's two
cheaper
sides
products,
of the same currency.
but we want the people making them to be paid more. People offering the services to be paid more. It's like you can't have both. We want it to be free, and we want them paid $1 million an hour.
You can, and that's where you have. And yeah, this is the difference between you and me. Sorry, I have no idea what's going on here. I think that's the difference between you and me politically. Is that I would say, then that's a government service, and even private childcare centres, the majority of the money that is going to that centre is not paid by the parents of the children, it's paid by government.
But where's government getting its money is my question there.
The government's got to make some decisions about where it puts its money, and for me it's putting its money into community security, health, education, public transport, not that we need it at the moment, road systems, those sort of things, rather than paying out businesses who are going broke when they screw up, those sort of things. But that's just a difference in people's positions on what do we do with our tax.
I don't necessarily disagree with that. I guess my fear would be that the can gets kicked down the road back to me, right? So I'm trying to find a childcare centre for Noah. I'm like, yeah, you should be paid more, and the government's going to subsidise it, and my taxes go up. And so I just pay more. And so it just goes around and around and around. And then what? We have inflation, so that life costs more anyway. And so it's a very difficult thing to balance, right?
It is. And it's a difference between user pays and community pays. Because I could sit, ignoring the fact that Noah is my grandson and I want the best care for him, I could sit here and say, why should I be paying for childcare?
Yeah.
Because my children are in their 30s, so it's completely irrelevant. I'm never going to have another child. Why should I be paying for childcare? If I stopped paying for it, in other words, my taxes did not go there, then you would be paying hundreds of dollars a day to send your child for childcare. And and if you decide you need it, then that's a problem, because then it just becomes a service that is only available for the wealthy. And it's the balance. And it's working out where that balance sits. So,
well, the struggle at the moment, right, is that wages haven't increased for a long time in Australia, but the cost of living has.
Exactly.
And so a lot of people in my generation, at least, are faced with, does the woman or the partner that is, the primary caregiver end up going back to work and then putting their kids into daycare? But if the difference is negative in terms of having to go to work, you make $150, $200 a day, whatever it is, and the childcare costs you $250 a day, you're set up with, all right, well, screw working, I'll just stay home. And you've taken someone out of the workforce.
When you and your sister were young and you went to childcare a couple of days a week, when your mum went back to work part-time, your mother, was making almost nothing in terms of the difference between the cost of childcare and salary. Now, that's no longer the case. The government subsidy to childcare is higher now than it was then. But that was a personal choice that was made because your mum said she wanted to go back to work and get back into the workforce. I think the challenge is going to be where people have to have two full-time workers in the family in order to be able to survive. Then one of them is effectively working for nothing or almost nothing, because you've got to have children in childcare.
Money's going in, out, yeah,
exactly. And that's when you've got to look at it and go, do we need to do this? Can we survive on one or one and a bit salaries and so on?
Well, and I said that with Kel, right? She was like, I feel bad. I need to have a job. I'm not contributing. And I'm like, well, you are. It's just not directly in terms of earning a wage and that money going straight into the family. You're allowing me to earn us a wage whilst you take care of Noah. And I would much prefer that Noah's primary caregiver is his mother or his father than a stranger. So, yes, we could probably find you a job where we can take that money and buy or pay for someone to take care of Noah. But it's like, if we haven't actually ended up in a better position, Noah's definitely not going to be in a better position than spending the bulk of his time at home with his family.
No, exactly. So
yeah.
It's an interesting one. So, news for the week. What have you got? I've got a couple of interesting things. I got a puppies and kittens story and a couple of other bits of rubbish, but what have you got?
All right, I got 750 million genetically engineered mosquitoes are approved for release in the Florida Keys.
Yeah.
So nearly 1 billion mosquitoes. This was really interesting. So apparently this plan is to release these mosquitoes in 2021-22, and it's just been approved. And the pilot project was designed to see if GMO mozzies, so genetically modified mosquitoes, would be a viable option or alternative to spraying insecticides to try and control, I think it's pronounced Aedes aegypti. Aedes aegypti, the mosquito, that's the genus and species name of the mosquito that spreads dengue, Zika, chikungunya, and yellow fever, but not malaria.
And malaria, but malaria is not.
Malaria is a different mosquito.
In America, it's
a different mosquito. Apparently, I looked it up as well. I was like, "What the hell?"
Same genus, but must be a different species. I think.
Yeah, so it was really interesting. So they paid a company called Oxitec from Britain originally, I think, to make, or at least this company made a mosquito that was effectively a sterile male that was programmed to die before adulthood unless it was grown in water that had the antibiotic tetracycline. So they obviously raised them in this water with tetracycline to have them go to adulthood, then release them into the wild, and they mate with all the females and outcompete the males who are viable.
Right.
And then the females who lay any eggs, the female eggs will survive, but all the males will die before they become mature and can reproduce. And you imagine you'll end up with
2 generations. You should have got rid of them.
Well, that's it. You'll end up with effectively skewed sex ratios between women and men, and the women will just end up having no one to mate with, no eggs to lay. So that was meant to be the idea. That was the first half of this episode of The Goss. If you would like to continue watching or continue listening to this episode, make sure that you sign up for the premium podcast or Academy memberships at aussieenglish.com.au, where you will get full access to these entire episodes of this series and much, much more. You can go check that out using the links below, or just go to aussieenglish.com.au. Once again, thank you so much for joining me, mate, and I will see you next time. Peace.